So we'll just quickly go through a few of the common misconceptions that you see floating around, and that might help clear your doubts. First and foremost is the query that it is bad for health. Now, over the last 30 years since the breast implants have been used, of course, there has been innovation in techniques, and even the manufacturing process of the implants has changed quite a bit. And in the past 30 years, there has been extensive research done, even in the US, which has not shown any associated health risks or associated increase in the risks of cancer, which is the most common fear that most women have with regards to breast implants. As far as the new study, the latest study which has come in, which is related to cancers in breast implants, is that in some of the implants, yes, there is a new or a different variety of the breast cancer that is more common with patients having an implant, but the incidence, or there is no increased rate of breast cancers with an implant as far as the studies which are done till now, even in the US and worldwide. Another thing which has been noticed is that there is an increased pickup rate of cancers. The increased pickup rate, when we say it, is that even smaller nodules are now noticed earlier. Maybe it is because once the implants are there, patients tend to feel their breasts more, so they do a self-examination more, so they can pick up smaller nodules quicker. And secondly is because you're feeling it against the surface of an implant, so you tend to pick up smaller nodules faster. So you go in and get a checkup done, and then anyway you're screened, so that is why your pickup rates are higher, and hence the treatments are also much more simpler, because you might not have to do a complete mastectomy. But there has been no studies which show an increased rate of cancer in patients with breast implants. The process is very painful, and I cannot get back to my normal activities very clean. With the new advent of the newer techniques of anesthesia and pain management, the process is actually quite comfortable now. And when done properly and without damaging too many things, and if it's done right with the right surgeon, your pain management should be pretty okay. Most of the patients within a week are back to their normal routine activities. Usually the first 2 to 3 days are the more difficult ones, especially if you're doing a biplanar or submuscular implant placement. At Aesthetics Plus, we do a lot of subfacial placement of the implant, which is less painful than a biplanar or a submuscular implant. And with the proper pain management, you should be quite comfortable to do the procedure. And when it's done right, usually by about a week, you should get back to all your normal activities. Of course, exercises and all are not allowed for about 6 weeks. Another misconception is that they're going to look fake. When it doesn't stay in proportion to your body, that's the time that it looks fake. So it has to be proportioned according to your breast size, it has to be proportioned according to your shoulders and your hips and your butt. So those are the body proportions when you look at, and yes, if it is not in proportion to that, then they look fake. If they are too big, if your skin is stretched out too much and it's not fitting into your body frame or your body structure, then of course it looks fake. So to prevent that, you have to do a proper consult with your surgeon. They have to actually measure you, they have to measure your breast size, and then achieve try and look out what is the size that you need, so that you can achieve a more natural look. At Aesthetics Plus, we try and do all this, and along that we also use sizes, so that you get an idea about how you're going to look. And then we have always tried to give you a more natural look. We don't like the fake kind of a look. And also it also depends on the placement and how your dissection is and how your pocket is and what kind of an implant is used. So when you're done right with the right people, it always looks very natural, and it's usually the implant goes behind your normal breast tissue, so anyway you cannot feel the implant. So unless the breast tissue is very thin, or you're putting it in patients who have absolutely no tissue, and if it's not put in the right plane, then yes, it might look fake. but most of the times when it's done properly with the right techniques, it looks very natural. And of course you need about a few weeks for the implant to settle into position, and that is when it starts giving you the more natural look. Bigger is better. I can get as big a size as I want. No, this is another misconception. As I said, we try to match the implant to your body size and your body structure. So if you have too big an implant, it is going to tear your tissues, so it's going to cause more issues, more problems. So it has to fit into the width of your breast. If this is your width of the breast, the implant has to fit inside that. If you use an implant which is too big, it is going to tear the tissues and cause more damage. And of course the weight of the implant is also there. So the bigger the implant, the more heavier the implant, it is going to be pulling and dragging onto the tissues and stretching them out and causing more damage. So bigger is necessarily not better. You have to do the measurements, we have to contour, have to check your body contours, you have to check your body structure, and then tell you what is the ideal size that would fit into you, and it's best to go with that. If you put too big an implant, it is going to damage your body structures. Another misconception is that it hinders breastfeeding. The implant goes behind your breast, so the breast tissue actually covers the implant from all sides, and because you're going from underneath and just going behind the breast, so it doesn't interfere with your breastfeeding in any way. When it's done right by the right surgeons, there is no damage to your breast tissue. The breast tissue is in front of your breast implant. When you get pregnant, it's again going to increase in size. The lactation is normal. It doesn't interfere in any way. Rare instances of some ducts being damaged can happen when you are doing a periareolar incision, that is the incision which is made around the areola. When we are going through that, even there, when done right, you don't have any damage to the ducts, but in some cases there might be some ducts which may be damaged, but it still won't hinder with your breastfeeding, and you should still be able to breastfeed after that. The cost, it is too costly for me. Yes, when you're putting artificial substance into your body, you need to ensure that it's of the highest quality, and that because it's going to stay inside your body for the next few how many years or decades. So you don't want to compromise on that. There are a few implants companies which we normally use, and we will recommend you. We'll give you a list of them, and then you can choose which is the best option for you. And yes, so that is why you don't compromise on the quality of the implant that is being used. Secondly, the cost of the surgery. The cost of the surgery, yes, when you're doing quality work, when we're doing proper safe work, there will be some price attached to it, but they are still quite affordable as compared to many other places, and they don't change vary too much. For example, your petrol prices go up, or your airfares go up because of the petrol prices. Here there are not so many fluctuations, and but when you're doing it quality, when you're doing it safety, when you're doing things, when you're putting into your body, you do not want to compromise on quality. At Aesthetics Plus, we have a no compromise policy for quality. We assure you the best of services and the best of products for the patients, because this is something that you're putting into your body. You don't want to take chances, but they are not overly costly or not unaffordable. And if you have any issues, you can always talk to our team for regarding payment plans, which we can help you out with. Another concept myth is that the implants need to be changed frequently and you need a lot of maintenance. The implants which have, in the past 30 years, the implants have also undergone a lot of change. Different companies are producing, the techniques have improved, the gel inside has improved. The third generation gel which is now available is, even if you cut the implant, the gel doesn't leak out. So you actually don't need to change the implants if you don't have an issue. Most of them are guaranteed for about 10 years because it's still a manufactured product, so they can only give you a limited kind of a guarantee. and they guarantee it for 10 years, and you get a guarantee card with the lot number and everything. And so if you have an issue, which they will replace the implant for you. But most of the times you have had patients who had the implants for over 30 years now without any issues, and they haven't need to change it. The saline implants which are used in the US, those are now being changed, and that is mainly because the saline leaks out, and once it leaks out, the implant size goes down. So unless you have an issue, unless you have a rupture, unless you have a problem with it, you don't need to change the implants. You can leave it in, and you have no long-term maintenance that you need to do. You need to do maybe a yearly checkup with your surgeon just to make sure everything is fine. And we don't advise an MRI every year. The worst that you could do is maybe get an ultrasound scan, so that will show you the integrity of the implant. It will show you if there are any other issues with it, and it's a simple, painless procedure. You can just get it done every year. I'm too old for the procedure. Well, age has certain limitations with regards to your health conditions, but as long as you're medically fit and you don't have any chronic health problems which are hampering your normal day-to-day activities, and all your investigations are within the normal limits, age is not a factor. You can do it whenever you feel that is the right time for you. So as long as you're medically fit, age is not a factor. You can go ahead and do it. Another myth is that any person can do it. We see so many clinics, so-called cosmetic clinics. We have doing it for cheaper places, and many a times the public or the patients go in there because they look at an advertisement and see that it's cheaper, but they don't actually check for the qualifications of the surgeon who is going to be operating on it. And it is very important that you identify whom you're going to, and it's very important that you need to find a plastic surgeon to do it. Plastic surgeons are the only ones trained to do a proper job when you're doing a breast augmentation surgery. They are trained to guide you what is good for you and what is bad for you, and they will do what is best for you. So always try and look at your credentials of your surgeon, check with them what they have been doing and what have they studied. Are they plastic surgeons? Because those are the ones we are trained to do it and have been doing it for the last this thing. And the main issue is to try and manage complications. If there is a problem, will they be able to manage it? As plastic surgeons, we are trained to manage all these problems. We are trained to manage whatever be the issue. But most of the so-called cosmetic clinics just think that it is just a simple procedure. You just do it and you go. And after that, once you have a problem, if you go back to them, they don't know how to handle it. So always check your surgeon's credentials, talk to your surgeon, get yourself comfortable, do your research, and only then go ahead for a procedure, because this is a procedure that you're doing once in a lifetime. You want that to be staying there. You don't want unnecessary issues with it, and you want the best. Another problem which people say is, I don't want people to know. What will people say? And whether they will say that I have something fake in me. Yes, if you are doing it for somebody else, if we have patients who come in and say, oh, my husband wants it, my boyfriend wants it, or they are telling me to get it done, we always refuse, because this is a procedure that you're doing for yourself. If you feel that yes, you need it done, yes, we will help you to do it. We will help you identify the right thing to do, and then we will do the right thing for you. But if you're doing it for somebody else, then please don't go ahead and do it, because one is, you're not going to be satisfied. Second thing, you cannot satisfy another person. They will change their minds. One day they say one thing, another day they say another thing. So it really doesn't make sense. So don't subject yourself for any procedure because of what somebody else tells you. If you have an issue with it, if you are feeling that yes, you want to get it done, then yes, please get in touch. We will help you out with it. If you have any other queries, if you have any other doubts or any other questions that you want us to answer for you regarding breast augmentation or any other plastic surgery procedure, please drop in a comment below and let us know, and we'll be happy to help you out. Thank you.